So thank you for joining us today and joining us for this COVID-19 webinar for businesses. We're very glad that everybody was able to take some time and join us for this, and so that we can provide some situational awareness and answer some of your questions. What we're going to go ahead and do here at Arizona Department of Health Services is go ahead and do some introductions so you know who's here in the room, and then we'll go ahead and get started and moving forward. My name is Eugene LeVar. I'm the Bureau Chief for Epidemiology and Disease Control.
I'm Kathy McKenna, and I'm the Chief for Healthcare Institution Licensing with the department.
Rachel Garcia, Public Health Emergency Preparedness.
Shane Brady, Deputy State Epidemiologist.
Nick Staub, Medical Director for the Bureau of Epidemiology and Disease Control.
Rosa Lira, Manager for the Preparedness Epidemiology Program.
Great. So we'll go ahead and get started today. I'm going to go ahead and hand the webinar over to Shane Brady, our Deputy State Epi.
Thank you. So we're going to talk today about the Arizona COVID response. And so highlight for our agenda today is to review the current outbreak and the response in Arizona, how you can prepare, what you can do, and answer any questions. And so the way we're going to do questions today is we're going to do them through the chat box, and we'll try our best to address as many questions as we can after the webinar. And then we'll also have options for sending questions in through a survey. All right, so in December, there were several local health facilities in Wuhan, Hubei province, China, with clusters of patients with pneumonia of an unknown cause that were epidemiologically linked to a seafood and wet animal wholesale market. The initial report suggested animal-to-person spread, but with a growing number of patients without exposure to the animal market, person-to-person spread was suspected. And then in January, the first case was identified as actually being a novel coronavirus. And by the end of January, there were over 9,000 cases globally. An airport screening was initiated in the U.S., and the first case in the U.S. was identified on January 21st in Washington. And then in Arizona on January 26th, the first case was identified here, an adult living in Maricopa County with recent travel to Wuhan, China. And then the Maricopa County Department of Public Health, Arizona Department of Health Services, and Centers for Disease Control and Prevention coordinated that local response and case contact identification, PUI classification, and arrangement of testing with CDC. In February, the WHO officially renamed the virus, or the disease, to be called COVID-19, and by the end of February, there were 51 countries with cases and over 80,000 cases identified. The U.S. had their first possible community spread of COVID-19 as well. So as you can see from this map, there's a number of cases that have kind of spanned out from China over the past few months. And I believe as of the 3rd, there was over 70 countries affected. And you can see this is a escalating situation. And the WHO is putting out good reports on a daily basis that contain this information. So COVID-19, talking about the virus. So COVID-19 is actually caused by a novel coronavirus that's called SARS-CoV-2. And coronaviruses in general are a large family of viruses. There are several known coronaviruses that infect people and usually only cause mild respiratory disease such as the common cold. Coronaviruses are also found in animals, and some of these viruses have the capability of transmitting between animals and humans or from person to person. So on to what we know about COVID-19. Well, there's a wide range of symptoms from very mild to severe, and symptoms can include fever, cough, and difficulty breathing. And again, this looks very similar to many other viral respiratory illnesses such as influenza. So the information so far suggests that most COVID-19 illness is mild. A report from China does suggest that serious illness occurs about 16% of cases. And really, we're concerned about older people and people with underlying health conditions like heart disease, lung disease, and diabetes, as they were twice as likely to develop serious outcomes versus otherwise younger and healthier people. So the virus is thought to be spread person to person via respiratory droplets that are produced when someone infected with the virus coughs or sneezes. And there's currently no available medication to treat or vaccine to prevent. However, there are efforts by scientists to develop those. And we're getting that presentation back up for you. Give us one moment. Apologize for that inconvenience. All right, we're back up and running. So, all right, so right now, we know that you can take everyday measures, including proper hand washing, covering cough and sneezes, and staying home when you are sick, which we recommend every single flu and respiratory season. So when we have these emerging pathogens, a lot of times what we're trying to do in the initial stages of a public health response is really containing viruses at the source and trying to contain it there through measures such as isolation and quarantine. And as these viruses kind of spread further in the community and across the world, we really try to work towards more community mitigation and preparedness activities. So we're going to discuss those a little more in depth. So, like you mentioned, in these early stages, we're really trying to prevent the disease from spreading it all out into the community. So, for example, like in Arizona, local public health partners have been monitoring travelers returning from China for symptoms of COVID-19 and ensuring that those individuals suspected of being infected were isolated until their test results came back negative. And as we're kind of moving into more of a community mitigation phase, again, from the national situation, it's becoming clear that there is a higher likelihood of community spread in the United States, and these public health measures are, again, shifting towards slowing the spread of the virus rather than containing it at the source. And as additional community cases are identified, it may be no longer feasible to isolate infected individuals and quarantine their contacts. Instead, public health may be working more with community and business leaders to really encourage social distancing. So the important question is, what can you do to prepare your business? Well, we want you to review policies and protocols for the following: for emergency communication, assessing your essential functions of business operations, preparing for increased absence in employees, and sharing plans with employees to explain HR policies, including sick leave flexibilities, pay, and benefits. So identifying critical job functions and positions and planning for alternative coverage, which includes reviewing your telework capacity and policies. Providing additional staff trainings to cross-train staff to ensure coverage in case people get sick and need to stay home. Ensuring that your sick leave policies are flexible and consistent with public health guidance, and that employees are aware of these policies. So other things that you can do to prepare are cleaning surfaces and objects that are touched frequently, including desks, doorknobs, railings, computers, keyboards, phones and toys, anything else that might be in your business. And we recommend using a bleach and water solution, at least a dilution of 1 to 50, or disinfectant with a label that says EPA approved for killing bacteria and viruses, and always following the directions on product labels. Additional things that can be done are consideration of postponing or canceling international business travel that could expose your employees to potential community spread of COVID-19. And business leadership is encouraged to consult with local public health officials when making such decisions. And businesses can also check out the CDC's travel notices for the latest guidance and recommendation on country-specific travel. So what can you do to prepare your staff? So CDC does not recommend that people who are in the general public wear face masks to protect themselves from respiratory diseases, including COVID-19. But we do want to ensure that there are supplies such as tissues and hand sanitizer that are well maintained and placed in multiple locations for ease of access. And we want to educate about everyday preventative actions such as staying home when sick, covering cough and sneezes with tissue and elbow, washing our hands often with soap and water for at least 20 seconds, and of course encouraging staff to get the seasonal influenza vaccine. We also encourage businesses to place posters that encourage employees to complete these activities that are visible at the entrance of your facility and other common areas to encourage these practices. So some additional resources are going to be listed below, and of course we'll have these slides posted for everyone to be able to access them and access these hyperlinks, but we have our AZDHS coronavirus website, the CDC coronavirus website, as well as our Arizona Pandemic Influenza Response Plan, which has some components to consider as a pan flu response has some similar activities as COVID-19, how to wash your hands in Spanish and English, as well as stopping the spread of germs in Spanish and English from the CDC. And then there's also employee responsibilities and public health response from the Department of Labor, interim guidance for business and employers, travel guidance, and small business international travel resources. So we're now ready for any questions that you have on how to prepare for COVID-19.
We've muted you.
If you want to enter anything in the chat box, but as always, we really want to encourage you with preparation plans to really work with your local health departments, as they really are the boots on the ground. All 15 counties in Arizona have a local health department who can help answer some of those preparedness questions for you. All right, and with that, we'd love to see questions in the chat, and we'll start to try to pull these questions up and get some answers for you. So the first question is, if you can please explain the process of communicating to a business when an employee is placed in isolation due to positive COVID-19. Further, which authority must the individual remain in isolation? Who is contacted to enforce the isolation? Sure, so depending on whether the individual who works for that business was actually infectious and at work, there might be different processes. So if they were infectious while at work, the local health department would work with that business to talk about kind of the messaging that needs to go out and all the response activities. However, there might be circumstances where that individual was not infectious while at work, and to protect their privacy, you might just receive a letter like we usually do for other diseases that just says this individual is not allowed to attend work until public health clears them. And so that might be kind of the policy going forward. And then for the authority, we do have in our rules for different infectious diseases, including novel coronaviruses, that there are public health authorities at the local health department to ensure that someone who has the disease isolates themselves.
There's a question here about whether where to send an employee for testing, and that the employee was unable to be tested. So currently in the state of Arizona, testing is only available at the Arizona State Public Health Lab. Testing for COVID-19 is referred through our local county health departments and then approved through the state health department. So there's a possibility that if an employee has symptoms of a common cold, that they are sent home and referred to their physician, and there's a possibility that they may not qualify for COVID-19 testing. Again, we're expecting that many of these situations will change in the near future as other forms of testing become available, but that is a possibility at this time. In terms of any special guidelines for immunosuppressed employees, so our recommendations for any person who is immunosuppressed is that they discuss the management of their health with their personal care provider, as immunosuppression can mean many different things for different people. And so again, we are recommending that they discuss with their doctor whether at this time, given the spread of the disease in the community, whether or not it's appropriate to be at work.
We have another question on, given the potential for undetected community transmission, at what point should we stop shaking hands, such as in church services or networking events? I think this is definitely something that could be considered during every respiratory viral season, as considering kind of limiting some of those activities. But again, really stressing people should be washing their hands, staying home when sick, and really try to avoid people who are sick.
There's a question here about whether or not conventions and public meetings should be canceled and how far ahead should this happen. So again, we're using the cancellation or suspension of large public gatherings as a tool to try to mitigate the spread of COVID-19 in the community. It really depends on the given business and the ability to reschedule or find alternative ways to meet, whether that's electronically. So again, we don't have strict guidance on when this should happen, and we leave that decision up to individual organizations. There's a question here about if there is any specific recommendations for restaurants. And given that this is a infection that's spread by respiratory droplet and contact, there's no specific recommendations for restaurants. This is not a foodborne illness. So restaurants should consider their business the same as any other would that's open to the public.
Another question on any recommendations for travel domestically. You know, the recommendations coming from the federal government are that it's still safe to travel domestically, and there's, you know, the considerations again are going back to those everyday preventative measures, washing your hands, especially after you're touching frequently touched surfaces, and avoiding touching your face and your mouth, and your eyes. Those things do help, and they help every respiratory season, and they'll help you with other respiratory viruses as well.
There's a question here about how to coordinate with local public health or the local county health department. So on our website, there is a link to your local health department and the contact information for that. So I would refer you there for a phone number.
And these slides will be posted, and the website is available as well that has some of this information.
There's another question about when you might consider canceling a large public gathering. And again, that would be up to the organizer, and it can be, again, in consultation with your local county health department if you have questions, and we would refer you there to discuss the specifics of your gathering.
There's a question about whether local health departments are prepared to field calls from coordination. Again, I would look at your business plans right now and kind of what you have in your policies, your preparedness policies, and you know, then approach it from there. The counties are experiencing a large volume call in this response and doing the best they can.
There's a question about disinfection and how frequently should you be disinfecting common things like doorknobs and keyboards. So again, the recommendations right now are for routine and regular disinfection of frequently touched surfaces, which those would be, and to use disinfectants and cleaners that you most likely are already using. We recommend that you carefully read the label on those products to make sure that you are allowing the proper amount of contact time. But again, everything at this point should be your routine guidance that you have for your facility as you would with any other respiratory illness such as influenza.
We have a question if we have to send someone home for mild symptoms, do we have to apply a 14-day isolation period? So no, so right now we recommend you use your current business plans. Many business facilities have 24 hours of resolution of fever symptoms. We also consider teleworking if that's an option for those individuals. But again, if there is a situation that does require someone from a public health perspective to be isolated and not attend work, public health will contact your facility to ensure that occurs, or the employee themselves.
There's a question about vaccines for COVID-19, and there's current vaccine research is currently being done, and there's a vaccine in development, but at this point, that is probably at least a year away from being available on the general market. So at this time, we are not relying on vaccination as a form for mitigation.
So this question, can you please explain that if COVID is expected to act similar to flu, why we need to worry about employees being placed into quarantine? I think this goes back again to what we're talking about during the presentation, is really kind of an initial response. We're really trying to kind of contain the situation at the source. And as we kind of continue in this response and we do, if we do see community spread, I think some of those actions such as enforced isolation, quarantine, may change because it may not be feasible if we're seeing this at a large population level.
There's a question about whether employee temperatures should be taken at the time that they're entering the business. And at this time, there's no guidance for routine screening for employers of employees. Again, I think relying on the symptoms that an employee is either exhibiting or reporting is the best way to decide on exclusion at this point.
So there's questions kind of regarding community spread and if there's, suspected we'll have more cases in Arizona. We do expect that there will be more cases in Arizona at some point. And really, we know that there are some commercial laboratories that are going to start onboarding testing, so that will make it a little more widely available in the coming weeks, but we don't have much more information beyond that.
There's a question on whether or not your physician can collect a specimen to be picked up and taken to the local health department. So at this time, any doctor's office should be able to obtain a specimen for testing. However, testing is only available right now at the state public health lab and has to be approved through the local county health department first and then through the state. Again, as testing becomes available at commercial sites, then the physician will be able to directly send a specimen to that commercial tester.
So we got questions about recommendations for closures of sites, and again, those kind of recommendations will be made by the local public health departments in conjunction with their investigation. And then there's questions also on kind of forecasting and, we don't know what the seasonality of this will look like. We're not sure. As more information comes out about it, we will definitely keep you all posted.
There's questions about whether warm weather will affect the outbreak and will this infection be like seasonal influenza. And again, at this point, because this is a new virus and we don't know exactly how it's going to act, we don't know whether that will happen or not. And so at this point, we are planning as if there will be continued transmission once it's in the community.
So is there a concern for exposure to the use of currency? We don't have specific evidence for COVID-19, but we know that other coronaviruses can spread through other surfaces and fomites. So like currency, we recommend that when you're touching objects that you wash your hands afterwards, and again, avoiding touching your face.
There's a question about who an employer would contact if they were aware of a person who is experiencing symptoms. And I think the first person you would contact is that person's primary care provider. And if their symptoms are more severe, then you would have to consider referring that patient either to an emergency department or EMS.
We're getting some questions about recommendations outside of normal cleaning and hygiene practices. Again, I think promoting, individuals to stay home when they're sick, whether that's customers or your employees to ensure that we're not spreading any other respiratory diseases.
There's a question about the time frame between contact and the virus, with the virus and symptoms. So for this infection and for other coronaviruses, we believe that the incubation period is somewhere between 2 and 14 days, and that's why you'll see 14 days used as the quarantine period. So that is what we're using during the containment phase. But again, as we migrate or move to this mitigation phase, you'll be seeing that we'll use that 14-day time period less stringently. So there's a question about screening patients who come to a clinic, or I guess you could consider this screening employees who are coming to work. So any patient who's exhibiting symptoms, again, we're looking for fever, cough, upper respiratory type symptoms like the flu or common cold. And so again, just looking for those symptoms and excluding from work if a patient is actively symptomatic. There's a question about running low on some of those things that we are asking for in terms of sanitizing and protecting people. So currently, and whether or not the Arizona Department of Health has access to provide assistance, currently we do not have that assistance, and so we recommend that you be in contact either with your local health department or other partners in the community to try and obtain those items.
And we stress hand washing with water and soap for 20 seconds is, you know, a viable solution if you cannot get hand sanitizer. So there's questions about routine cleaning. Do you mean daily, multiple times a day? We recommend following your usual business practices. And again, some areas with that are highly frequently touched, we recommend those being cleaned probably multiple times a day, but kind of following your best practices that you've already have set up in your policies and procedures.
There's a question about whether symptoms are similar within different age ranges, so from infancy, childhood to older adults. So symptoms are all similar, but some of the complications are different. So if you see reports that older people are having more complications, that's very consistent with other respiratory infections such as influenza. So again, the symptoms of the infection are similar, but the complications are different in older people. So there's a question here about if the case is identified at a business, what are your recommendations for closing the business and for how long? So currently there would be no recommendations to close a business if a patient was identified. Again, the local county health department will conduct an investigation, and any recommendations for closure or cleaning would come from your local county health department.
So there's questions about kind of how recommendations are going to evolve. We will be updating our website regularly, so that is really the best place to check for things. And, you know, we are trying to communicate in every avenue possible, but our website is probably the best source for that communication.
There's a question of how long droplets from an infected person remain contagious on a surface. So again, research is being done into this new virus to determine that, but we know for other coronaviruses that those droplets may remain on surfaces from hours to as long as days, or 2 days, I believe is what we're saying. So again, this is the reason for routine cleaning and disinfection for surfaces and frequently touched surfaces. There's a question about the use of masks. And at this time, there's no recommendation for the use of masks in the general public. The recommendations for infection control using a mask is only relevant for healthcare facilities, and we are not recommending that the general public use masks.
There's a question about CDC confirming positive tests from local labs. So at this point right now, and this, again, the situation is evolving, the tests that we perform at the Arizona State Public Health Laboratory are considered presumptive positives. However, we are treating and responding as if they were confirmed positives, and then those specimens are sent to CDC for confirmation.
Question from an HR physician: what can I do to ensure that my staff is safe and well protected? I think the best thing you can do is make sure that your staff is aware of attendance policies and sick policies, and knows that if they are exhibiting signs of illness, that they should exclude themselves from work, and that they are allowed to do so.
So we've had questions about shipping, getting items from overseas, and whether there should be concerns about that. So again, we recommend if you're touching other items that you wash your hands afterwards, and so that good hand hygiene should help protect you from all sorts of respiratory viruses and concerns. So washing those hands with soap and water for 20 seconds.
It's a good question about volunteers in organizations, and are there any specific guidelines? One guideline that we have suggested is that at this time, if you're trying to, as we're trying to mitigate the infection, that only the maximum number of people who are required for any given organization be there. So if you are having illness in your organization, a volunteer may be one of those people that's not absolutely necessary for you to continue your work and may be excluded.
There's questions on how long individuals are infected for. Right now, again, this is a new virus, and so there still are kind of studies to find out how long someone is actually infectious for. And just because we're detecting the virus in tests doesn't necessarily mean they can spread to other people. So that's kind of an ongoing question, and one we're hoping we can find some answers to in the future.
There's a question about whether we are more concerned or whether it makes a difference if it's a wet or dry cough. And in our current definition of the diagnosis, it is not, there's no difference.
We're getting feedback on trying to put updates to the website and make it clear that they are updates. Thank you for that feedback, and we'll try to incorporate some of that into our practices.
There's a question about should businesses deal with delivery by UPS and Fedex when you don't know whether or not those people may have symptoms. Again, we know that the transmission of this virus happens between people who are in close contact. So that's defined both by how close proximity you are in terms of a distance, and then also for how long. So for kind of routine, quick deliveries, the risk of exposure is very small. So I wouldn't be particularly concerned about those short, quick interactions such as a delivery.
And then we're getting questions about the business section on the website. So we are working on developing that, and we're hoping we can have it up and running by the end of the week.
It's a question about whether normal detergent will rid your clothing of this virus and droplets, and the answer would be yes.
There's a question about immunity developed once an individual is sick and recovers. So again, that's another question that we're waiting on researchers to answer.
Question about whether employees who travel to foreign countries be allowed to come back to work, or should they go through a quarantine period. So currently, travelers to those areas, those geographic regions with high transmission are receiving guidance upon return to the U.S. that they should be quarantined or stay at home and watch for symptoms for that period of 14 days. So that is being done by local public health, county public health. So for travelers to other locations around the globe, there's not currently guidance for restriction. And that is for an asymptomatic person. Question about how long would we suggest to someone not to book travel outside of the country. And again, your best resource for that is both is the CDC website that lists those travel warnings. And again, right now it's not absolute that people cannot travel to those places, but it's just a warning that there's transmission there and that you are at risk to be to get sick if you go. So there's not currently any recommendation not to travel.
Great. Thank you, everyone, for your questions.